welcome to Our Point of View talk show. We're so glad you're able to join us. We're going to go ahead and introduce our hosts. And see, Jennifer, how are you?
Hey guys, I'm doing great. Good to see everyone here.
And then we have Derek, our state representative, Derek Jackson. How are you doing today, sir?
Hello, Jacqueline. Another fine, beautiful day.
Good. And I see we have Captain Jackson.
What up? What up? What's up?
I like the way you slid in there.
I just kind of just just slid on in there.
Good job. We're glad you're here with us. And we also have with us again, we have Dr. Kay Stevens. How are you?
I'm doing well. Hello, everyone.
Hi,
What's up, Dr. K?
We're so glad you could join us today. And we're also going to have a little later, we're going to have Meaty with us. But right now we're going to go ahead and start the show. We're actually following her on her journey through the coronavirus. So we're going to start with Dr. K. So can you talk to us a little bit, give us some updates of what's going on with the virus?
Yes, it's mutating and mutating and mutating and mutating some more. So right now, there's a lot of concern about the vaccines being able to really be effective against the UK variant, which they found another mutated form of the UK variant that they're looking at. So, and then we have the South African variant that is worse than the UK variant. So, as of last Monday, Moderna has said that their vaccine is effective against the UK variant. And so I don't know if I said on this show, but I sat in on the FDA EUA authorizations for both Pfizer and Moderna vaccines. And Moderna did state that there were 5 variants of concern that they were researching. So the UK variant was one of those. However, the South African variant is new, is newer. And so they are back in essentially clinical trials. So they're doing another clinical trial. And so what they're saying is that if you've gotten the Moderna vaccine, you may have to get a 3rd shot.
Ooh.
So, what?
Yeah.
Oh, come on.
Oh goodness gracious.
See, you play too much.
Yeah. I'm just here to give y'all the facts. I don't have.
You just
Yeah.
Dr. K, so with that being said, so I get the impression because of all the mutations that you just described that's happening, just for our audience, I see this as the same as we do annually with the flu shot. Every year we take the flu shot because of different strands, different mutations, if you will. And so every year I predict that we're going to have to take this coronavirus shot, booster, whatever you want to call it, in your field every year. Do you get that same sense? I mean, I'm just a policymaker, but it just makes sense to me. Listen to all the epidemiologists and those subject matter experts such as yourself as you give this this overview of where we are. I see, today is a UK variant, African variant. Heck, we may have some US variants, right? Because the United States is one big melting pot. So I just see this as every year we're going to have to add this to our flu shot.
Absolutely. And so it's kind of like, and I don't want to say that the vaccine was rushed. I definitely don't want to say that. However, it was still mutating when the vaccine was created because we needed something with all the deaths. Right. And so as a result of that, we're still trying to play catch up, if you will, because it has mutated so much. And so when we have other countries like the UK and Australia and South Africa that kind of flatten their curve, and so they had the opportunity to go out and they traveled and they were able to socialize into the community. So when that happens, the virus can mutate. And so then when the fall and winter came, and so and people have been socializing after being out and about. So unfortunately, that's what happened. So just like the flu mutates every year and you have to get a different shot, the same will probably be the case for COVID.
Okay, Dr. K, may I ask you a question, please? Can you explain to our viewers what mutate means? Because some people may not understand what that means. And we're seeing a lot.
Absolutely. So when we say mutation, so the virus is an RNA-based virus, which we already know. So it has proteins, and we know that the proteins are kind of coded by amino acids. So we all know what amino acids are, right?
Right.
And that they have codes. So essentially, when COVID mutated, there were like code switching. So instead of like it coding for like threonine or alanine or something like that, it did a reversal. And so basically that's what's happening. It's so when the vaccines were created, they basically read the normal code. But when the mutation happened, so instead of having like A or an L or a T, it substituted another amino acid. So just to keep it very like base level.
But you know, and for our audience, Dr. K, and I appreciate you know, breaking it down that way. But when I think of it as you know, as our society becomes more global, you know, today is the coronavirus. It you know, during President Barack Obama's tenure, it was Ebola, Zika, H1N1, swine flu, right? So this is not like, you know, once we do get a vaccine to deal with it, or a booster, if you will, to deal with the various strands, I still see us not returning to norm. In other words, like I'm in the business of shaking hands, you know, kissing babies, right? Them days are gone of shaking hands and kissing babies as an elected official, right? I still see us wearing our masks. You know, Michael Jackson was ahead of us. You know, when he used to wear the mask in the late 80s, early 90s, people thought he was a germaphobe, but he was really, you know,
He's ahead of the game.
He was ahead of the game, right? So I don't see us, you know, going back anytime soon.
No, I don't either. This is the new.
And unfortunately, it will be for a while until we get ahead of the mutations. So, and it's not as aggressive with the infections.
Well, Dr. K, can you tell us how things are going as far as the number of vaccines that are available here in the U.S., how that is being distributed, and sorry about that.
So I am working at the state level with trying to get the vaccinations orderly, if that's a good word. Unfortunately, because there was no, and I think we talked about this before, like there was no federal oversight on vaccines, and they left it up to each state. And so each state just kind of did its own thing. Like Florida just totally disregarded like the federal mandates, and they were like, whoever wants one can have one. And it got out of control. And so, and even here in Georgia, there were some counties that were vaccinating people that weren't on like in our list. We're like 1A plus now. And so I think it's Elberton County now is on probation from receiving vaccines for that very reason. And as of what's today, Wednesday, Monday, or was it yesterday? Y'all, my days are like crazy, but the White House COVID task force did announce that they would be sending vaccinations directly to like the chain pharmacies. So that would take some of the lift off of states, especially I know like here in Georgia, because when you think about all the Kroger pharmacies, the Publix, Walgreens and CVS were already receiving vaccine allocations for distributions to nursing homes. So essentially what that will do is free up basically the local health departments and the major hospitals. The vaccines that were going to those chain pharmacies could now be more so focused on the local health departments and the major hospitals.
Now, what about that one gentleman, the 22-year-old who he was helping administer the vaccines, and there were 4 left, and he took them home and gave them to his friends?
Yes, that was very much illegal.
Now, my question about that is, okay, if that's the 2 shot, you took that home and gave it to your 4 friends. So when the 21 days is up, or the 28 days, are you gonna steal 4 more to give them their second shot?
Or because they wouldn't be able to get a second shot. I mean, I live in North Atlanta, and I'm on like our like next door app or whatever, and so my neighbors were saying, oh, we were able to get our first dose of vaccine, and I'm in DeKalb County. They were like, we went to Fulton County, and I was like, okay. And so circle back yesterday, they're back on the app saying, well, now Fulton County says that we have to live in the county and we can't get our second doses.
Wow.
What are we gonna do?
Wow.
Well,
So what do you have to do? Start over and get the first dose again?
So it depends. So the CDC has determined that you can actually go 6 weeks between your first and second dose and still be considered compliant.
Okay. Well, ladies and gentlemen, I would like to introduce Miss Meedy Bartinelli. She joined us. Hi.
Amy.
Hi, everyone. Thank you so much. And I am so sorry for my delay, hospital duty and COVID duty calls.
We're just talking about the vaccine and everything. So Dr. Kay, you want to go finish your statement?
Oh, just about distributions. And so, yes, most certainly, if you want to be vaccinated and you are unsure where to go, so there are going to be some campaigns coming from the state health department for those that need help. I've been working with our vulnerable populations because there are some elderly, people who just don't know where to start. They don't have computers and they really don't have time because we're not receiving as many vaccines. And I don't know if you guys have been keeping up with the news about, I know Grady and DeKalb County Health Department made some statements about only receiving like 100 doses of the vaccine, which is true. And the state can only allocate what they receive. So pack your patience. The state of Georgia is trying. And if you have an elderly relative or loved one that wants to be vaccinated that doesn't know where to start, please help them, because you will have to help them register online. And unfortunately, it's not like a register one week and get it the next day kind of thing, because of how the vaccines are being distributed in the state. So if you register this week, if you're able to get an appointment this week, it may not be until next week or the week after that you're actually able to get like your first dose or your next dose.
Okay, well, speaking of doses, we have one of our guests on Facebook Live who have a question, and her question is, would there be a problem if your second shot is not on time? Will there be an issue if you don't get your second one on time?
No, so that's what I was just saying. The CDC has put out that if you are not able to get your second shot within that 21 or 28-day window,
Mhm.
you can get it like 4 days early. But if it has to go beyond that 21 or 28 days, you can have up to 6 weeks between doses, your first dose and the second dose.
Okay, okay, okay. Well, for those of you who have been following us with Meedy Bartonelli, we're following her journey with the COVID-19. So do you want to catch us up on how things are going with you, Meedy?
Sure. Thank you so much. And again, my apologies for being late. Some issues at work that I had to tend to. So again, my sincerest apologies. Timeliness is very important. But thank you for the question. I'm here. I'm alive. I'm well, and I'm grateful to God that I am part of the 26 million people who have survived COVID-19 here in the U.S. and that are on the other side versus that 400,000 number that have passed away. And so continued thoughts and prayers to those families, because until you've gone through it, you really don't understand, because there's a lot of fears and anxieties. And I've been sharing this with you all from the very beginning with Representative Jackson back in the summer, late summer, I believe we did an opportunity to share. Then after my vaccine, my first dose was on December 23rd. And then to me actually contracting COVID, being with the positive test on January 4th. So subsequently, I have entered into a trial with Johns Hopkins University and MedStar Health here in the Washington, D.C. area, where 3 days post my positive test, I received a transfusion of blood plasma. And the plasma is supposed to, and it's a double-blind study. So I don't know if I received additional antibodies or not. And I won't find that out until the study is unblinded, I believe sometime late spring, early summer. And what the intent was to give me that blood plasma transfusion with the hopes of reducing symptoms. The symptoms that I've had subsequently, I completely lost my smell completely. I sprayed stuff on my hands, held it right up to my nose and couldn't smell anything. So Lord knows that there was a burning building, I would not have known it because I could not smell anything. I had diminished taste. I still could taste, but it was definitely diminished. I never lost my appetite, so that's a positive because I love to eat. And I had a lot of fatigue, so much fatigue, to the point where living here in DC, I could barely keep my eyes open on the 6th when all the insurrection was taking place. And I was in quarantine at that time, downtown DC at one of the hotels. And so subsequently, I now have high blood pressure, which I never had before. And I know I've been sharing that with you, Jacqueline and Dr. K, over the last few weeks, where I just noticed that I went back to work, everything was fine, but I felt a pressure. And I wouldn't really say pressure, I probably would term it tension. So imagine somebody kind of just resting their hand on your shoulder. It doesn't hurt, but you obviously know it's there. And also behind my neck. The day that I came back to receive that blood plasma transfusion, my blood pressure literally was 165 over, I think, 115. And I'm like, oh my God, that's not me. Like, that can't be right. And those of us in the healthcare field know that some people have white coat syndrome. You know, you get nervous, you have anxiety. So we basically trumped it up to that. That obviously I've been in quarantine and I'm nervous and I'm scared. And now I'm getting this blood plasma, which I've never had blood nor any blood products transfused ever. And so she took it again 3 times, separate arms, and it was still very high with the high diastolic. So we just said, you know what, this is just your anxieties and fears. Let's see what happens. So no worries. Go finish quarantine, back to work. I'm cleared, went through all the testing and the contract tracing with DC Health, as well as my own medical facility, and went back to work. But I just knew that something wasn't quite right. I'm an avid person who works out. So literally the day after coming home, I went out and did 3 miles, true to who I am. And I did 4 miles a subsequent day. And the third day I did 5 miles just to kind of see how I felt. But I still just knew I wasn't quite right. So Jacqueline, insulin, what I realized is that following Monday, I took my blood pressure again at work at the hospital where I am, and my blood pressure was 159/109. And I said, okay, clearly this is something that is sustained. Being in the healthcare profession, like Dr. K and others know, I immediately got on the phone, called a friend who's a cardiologist, and said, I'm not a hypochondriac. I know I'm not crazy. I'm a cardiac ICU nurse, and I've never had high blood pressure ever. And so, long story short, which it's already a long story, I'm now taking amlodipine, which is Norvasc, a 5 mg low dose. I take it every night because my diastolic, that bottom number, should be basically 80s or below, which is optimal, right? And so because I could still feel the pressure, and quite frankly, sometimes I still feel it now, even though my numbers are better because of the hypertension. And we couldn't figure it out. I had ultrasounds done just to make sure the cardiac area and my renal function was fine. My blood work came okay, other than the fact that I'm severely vitamin D deficient. So which I already knew prior to this. And I take 50,000 units of 50, so that's a lot, 50,000 units once a week of vitamin D. And then I'm now taking this Norvasc every night, 5 mg. Ironically, my friend, actually shout out to Dr. Reginald Robinson. He's an amazing cardiologist here in the DC area, Howard Med School grad and Morehouse undergraduate graduate. And he subsequently told me that ironically, he found that there were 4 other patients that week that he then saw that now are hypertensive post-COVID who were not prior to. So basically, I'm assuming, natural assumption and differential diagnoses would then assume that it is an inflammatory process from COVID that my body is still kind of go through. Dr. K can probably speak more to it with the work that she does in the lab. But when your body is starting to produce antibodies, there's a reaction to that. It's not a normal thing. And so when you get a virus, it's not like I took any antibiotics to kill it. It's not like I did anything to it. Your body still has to work through what that looks like and how it's recuperating. So very, very intricate story. I'm not happy that I'm on blood pressure meds at the tender age of 45. I'm an avid person who works out. I'm not obese. I have no other comorbidities other than the fact that I recently had COVID and now I'm taking blood pressure meds.
Wow.
Exactly. That's exactly how I felt. So what I would say, and you can notice my little red necklace, it is Heart Health Month. And I do implore and encourage anyone who has had COVID that once you are quote unquote recuperated, please make sure you are following up with your physician. They need to know, you need to be sensitive to your body. You need to know if there's any changes. If you know that there's something just not quite right, because again, COVID is still something that we are investigating and learning from. The vaccine is not been touted as a cure, right?
Mm-hmm.
It is something that should hopefully to reduce symptoms. So it's really symptom management. I'm sure Dr. K again can agree to that. They did not say that having the vaccine is curing you or prevents you from getting it. It basically, hopefully will prevent your body from having a type of reaction to it where some people, obviously succumb to it. Some people have worse symptoms from it. And so that's what we're dealing with right now.
Okay.
So Amity, thank you for always sharing your story and bringing your journey.
Yeah.
It's great seeing you.
You too.
So here's the question, and we posed this question to Dr. K, and now that you're going through this blind study, and every day we're starting to hear that there's these new variants out there, right? It's the UK today, the other day was Africa, so on and so forth.
South Africa.
So was
Brazil.
Exactly. So was this study that you're going through with Johns Hopkins, with that, are they, looking at, what happens for a young, healthy, vibrant 45-year-old encounter one of these other strands? Do you get a booster shot? I know you still wear your mask, following you on Facebook and all. So there's some things you still do, even though you've gone through the vaccination process. But because you're going through a study, are they saying, okay, listen, we getting all these mutations. Let's take this group of survivors, and let's impose or let's track and see what happens if they encounter one of these other strands.
So the short answer is yes and no. Short answer, I mean, the yes meaning that I have had repeated blood lab work done, but I did not get a separate COVID testing to see if there's a different strain. So what they might do to see if there's something within my white blood cells or something that is different, because within your white blood cells, you have eosinophil, like there's different things that even make up your white blood cell count. And that also then lets them know which type of bacteria or virus, if you will, that your body is trying to fight, because some of those numbers are going to be a little more tilted, and that way they can make that diagnosis. So far, what I know of right now, it was my plasma transfusion was a convalescent plasma transfusion to reduce the symptoms of COVID. So my symptoms in theory, comparative to most others, quite frankly, was very mild. You know, I wasn't hospitalized. I did not require, and mild meaning, and I should say, it wasn't mild to me, but mild as a nurse, I know that it was mild because I did not require supplemental oxygen. I did not require hospitalization. I did not require, IV fluid to maintain anything. I was still able to eat and maintain my nutrition. I had no GI symptoms of nausea or vomiting. And so in theory, as they're kind of categorizing what these symptoms look like, mine were pretty much more so on the mild side. So I won't know the totality of everything, because once you do have a double blind study, they don't tell you if you received the extra antibodies or not. And so I could have just got no antibodies and just plain old blood plasma and nothing. But if I did get plasma with additional antibodies, and I want to clarify, if you're not sure, that means they have created people who have already tested positive for COVID. They took blood from them because their body already has the antibodies because they've tested positive. So if you were to take my blood from me today, I would be positive for antibodies because I've had the virus. And then they would take my plasma, Representative Jackson, and then infuse it to you. And that obviously, if our blood type was the same, to then hopefully give you a boost, if you will. So people are talking about the booster shot, because it's not a booster, as Dr. K, I heard her say earlier, it's just a second dose, but the plasma would be considered like a booster to kind of boost your system and to give you additional antibodies. And unfortunately, that's why I said it's a yes or no, because it's a double blinded study and they didn't tell me. So I don't know, but I do know my symptoms again, because I did have the first dose of the virus, the first dose of the vaccine, excuse me, that definitely helped me out as it relates to my symptoms not being as bad.
Well, I have a question for you, Midi. For other patients who've received the plasma infusion, are they going through that study as well, or are they receiving the actual plasma?
No, typically what they're doing, patients who have actually been admitted into the hospital, who are now in the ICU, who are on ventilators, they are getting antibody plasma. So it is confirmed that you are getting plasma from someone who previously had COVID to give you those antibodies, because they now require.
They'll let you know if you're going to go through, if they chose you to go through the study.
Correct. They will absolutely tell them. Yes.
Okay, great.
I have a question for both you and Dr. K. For those who do more practice holistically in terms of their diet, the fruits and vegetables and those things, what sort of advice do you give to them as far as maintaining that good health and making sure that they eat the right sorts of foods and so forth, and their exposure? What sorts of information would you give to them?
So the first thing is, anytime you have a virus, your body's going to respond to it. And anytime it has to do that, you kind of have an inflammatory response, sometimes at a cellular level, and other times where it can be more severe, like when you have cardiac disease and people have a lot of edema, the swelling in the ankles, et cetera. Right. My recommendation for all of us is to limit our sugar intake, because sugar causes and amples up, rather, if you will, inflammatory processes. Additionally, vitamin C, zinc, vitamin D, because I think when you start to have the fatigue because those things just naturally boost your immune system. African Americans, it's noted there's millions of studies that talk about us being vitamin D deficient. I was vitamin D deficient prior to COVID, which I knew that, which therefore my fatigue fatigue was more magnified on top of having COVID because I was already tired because of the fact that I'm vitamin D deficient from time to time. And I'm a runner and I'm always outside. So it's not that I lack sunlight at all.
Right.
So I think for me, but I always say this, speak to your doctors first. Do not just start taking, because I'm taking 50,000 units of vitamin D. That is a prescription strength dose that I'm taking once a day. So I'm not going into, the CVS or Walmart or Walgreens and just taking, 5 or 10 of those pills on my own. That is something that is prescribed by my physician. Anytime you take any medication, your body excretes it either via your kidneys or your liver. So you have to always make sure that your kidney and liver functions are well before you take anything. Something as simple as Tylenol, I think we talked about that before, it can kill you. If you're a person who has severe liver failure or cirrhosis or something, and you're popping Tylenol to relieve pain, you can actually exacerbate your disease process. So, but typically speaking, zinc, vitamin D, vitamin C, those are things that people are, recommending to help manage some of those symptoms. And I think, and if you, quite honestly, if you take a really good multivitamin anyway, there's vitamins out. Prenatal vitamins are amazing for women, even if you're not having children. Prenatal vitamins are great. But again, all those things, just want to, full disclosure, don't say Nurse Meady told me to. Nurse Meady said to take it after you talk to your doctor.
Right.
Make sure you speak to them to ensure that your everything else in your body is okay to manage that. Because it is still drugs, right? If you're not eating it well, it's still medication that you're taking.
Okay, sounds good. Okay, we have another question from our Facebook Live. We have a question that says, what's the vaccination protocol for seniors who have had?
Jacqueline, I'm sorry, there's a little bit of an echo. Can you repeat the question?
I'm sorry. What's the vaccination protocol for seniors who have had the antibody fusion?
So from my understanding, and Dr. K, please chime in after me. I know where I'm working now. For seniors, if you've already received antibodies, like an actual plasma transfusion, they are now asking you to wait. I think it's 90 days before you go and finish you take your vaccine. However, what they were saying before, and I was a person who actually vaccinated over 50 people myself, they said if you already had COVID within the last 90 days, to not take it and to wait. Well, for my CDC has since lifted that, recommendation, indicating that even if you had COVID, you can take it. I forgot to share this in the story. I did not take my second dose yet, only because I'm in the study. And so once I know that, then I will be taking the second dose. Yes. But right now, there's no different from seniors, or even if you're in your 40s or 50s, you should absolutely get your second dose, even if you already had COVID. But if you're in a study, or if you got transfusions, that needs to be done at the recommendation of your physician and or your infectious disease doctor.
Okay.
Sounds good.
Do you have any other thoughts about that, Dr. K? I don't know if there's anything that you read. I know you're really intricate with that.
Yeah, as of last week though, they're recommending. So if you get COVID between your first and second dose, wait 90 days. If you get the plasma transfusion and you're not in a study, you have to wait 90 days before your second vaccination shot.
So it's going to still work the same as if you were getting it the 21 days or the 28 days?
Yeah, actually, I mean, and just to be transparent, even though we're saying the EUA authorization is 21 and 28 days, but the governing body is saying that if you get your second dose within 7 days, like there's no non-compliance, because we just don't know. We don't know what will happen if you don't wait 21 days. That's just what they did in the study. So we're just following what they did in the clinical trials.
We're just following the protocols. And so again, people, that is the part about, having a new vaccine, is because obviously those are all things that you kind of would normally work out. But at the same time, we haven't had 450,000 people die in the US. And so that's why it's basically your risk benefit, and there's greater benefit to get the vaccine versus to not get it.
Right.
So speaking of protocol, to my knowledge, there are only 2 approved vaccines. That's the Pfizer and the Moderna Pfizer has 95% efficacy, and Moderna has 94.5 efficacy.
Representative Jackson, I
Johnson-
just want to clarify really quick. I think words are powerful as we move forward. And when you say approved, make sure we say there are 2 that have emergency use authorizations, because I think people that are non-medical are thinking that, again, that approved means if you get it, you're fine, you're not going to get COVID. And everybody needs to understand both of these, Pfizer, Moderna, both received emergency use authorizations. They have not been approved and a signed stamp that says this is it. That's very, very important. Sorry.
Okay, so I'm glad you added that clarity, Meady, because my question to you and Dr. K, then what's going on with Johnson & Johnson? Because I understand they're not approved for use of emergency or so Johnson & Johnson and I could be butchering this, AstraZeneca.
You got it.
Okay, and so Johnson & Johnson is 1 dose, but it has a 72% efficacy, and then AstraZeneca is 2 doses, but a 70% efficacy. So the question is, as these more vaccines come on the line, one of my constituents asked the question, will they now, when Johnson & Johnson and AstraZeneca come online, the one with the 70% efficacy, will that be pushed in the urban communities? And then meanwhile, the ones with the 94 and the 95% efficacy still be pushed in, or will all states get the chance to disseminate these vaccines accordingly? Because that's part of the problem right now, that our community is just not comfortable. I mean, I've told my constituents, I said, listen, after my nearly 23 years in the Navy, I have more shots. That's not shots in drinking, y'all. I'm talking about shots in the arm because of special missions and countries I had to go to. I had to get a shot because those third world countries do not have the same type of health care that we have in the United States. And so what they do for men and women in uniform that have to go to other countries to make sure that they're by our body, because we are the weapon. All right, it's not the bombs, not the missiles. We're the weapon, and so they got to protect the weapon when we go into other countries against yellow fever and all these other list of things that I'm sure Dr. K and Meady can break down. But my point is, as other vaccines come on the line and they're cleared to meet Meady's description and definition, who disseminates what? Because I'm here to tell you, between those 4, I want the 95% efficacy.
So
I don't want the 70%.
You opened up Pandora's box, and I know we've had several of these conversations, and that's another one because it's going to be completely different in a month from now. Basically, the short answer is we will absolutely, this is Meady Barnelli's opinion, we will absolutely start to see discrepancies with disparities and inequities based on which one. It's kind of like, do you want the Benz or do you want to get, the Ford, right? So you want to talk about luxury, and not that Fords don't have great cars.
Okay, I'll jump in here, because let's just talk about these new vaccines, because this is why we're here, just so we don't have people, because we already have vaccine hesitancy, and we have a lot of people that don't understand vaccines that are talking about them out, in the public. So let's just go back. So we do have Johnson & Johnson, which is 1 dose, and they did their clinical studies in Brazil and South Africa. So they were more effective in those 2 countries. Their efficacy for their trials here were just a little lower. But we have to keep in mind that Moderna and Pfizer had to be 2 doses because their first dose was only 50% effective. So Johnson & Johnson is 1 dose, and it's about 70 to 85% effective. So keep that in mind. The other thing
I'm glad you said that, Dr. K, because I'm a lawmaker. I'm not an epidemiologist. I'm not like you and Meaty. I did my research because you're exactly right. I said, well, wait a minute. Johnson & Johnson, 72% effective in the United States, 66% effective overall, and 57% effective in South America. But then preventing severe disease was 85%. And so what's the population size? What's the sample pool? What's the health care? I mean, when you look at, and I've been to Africa more than I care to agree upon, they don't have the same kind of healthcare system or access to nice, healthy foods, right? They don't do like what Meaty was talking about, running, 3 or 4 or 5 miles a day, right? They don't have that opportunity because they're in a different kind of ecosystem altogether. And so when I was doing my research, because I knew Dr. K was going to question me, I was like, so because as a lawmaker, all I want to do is get the vaccine from the manufacturer to responsible healthcare practitioners to get it in the arms of citizens. That's it.
Yep.
Right?
And
I don't gauge 70%. I don't gauge which one's the Rolls Royce, which one's the Benz, which one's the Volkswagen. I want to make sure that I live in Georgia. So for those who are outside of Georgia, it's not that I'm anti. No, but I got to keep Georgians safe, right? And so my goal is to advocate for Georgians to say, how do I get it from the manufacturer into the arm? And mitigate it to where they don't have all the side effects that Meaty has been sharing with us during her journey.
Well, I think the other part of that too, Representative Jackson, is also the availability of it because, Pfizer, Moderna, remember there's a huge conversation about the refrigeration. So I do think the more rural areas will be able to manage based on their healthcare facilities, those other manufactured vaccines that don't require that as much. Even when you talk about, people on the Native Americans on the reservations, right? My family is from, both sides of my family are from Georgia, and they're in very rural areas where the nearest medical hospital, which is probably less than 100 beds, is still nearly 30 miles away, right? And so even where my family resides down in Telfair County, they have, it's going to take them a long time to get there. How are you going to get all of those individuals that still live out in the farms that may not have the vehicles to drive that 30 miles? So if you are able to use those other vaccines that you mentioned that don't require, the sub-zero type refrigeration before they are reconstituted, it will still provide some coverage, right? That's just my personal opinion. I hope that people like you and those people that this is where it does become political, because that's when they have to make sure that they are budgeted and that they're requesting and making sure they're putting in the requests, and that our government did put in enough requests, because we had heard that conversation, earlier back in November, when we were told the US only ordered a certain number. But then don't forget, this pandemic isn't just the United States. So you have people worldwide fighting, right? Bargaining to get the vaccines, even for their constituency, even in Europe and other countries. And so we have to be very mindful of that. But at the end of the day, to your point, whether I have the Rolls Royce, the Benz, or the Ford, or the Pinto, I need a car to get to work. So I need something that is going to protect me, to keep me safe. And I think the key word that you heard Dr. K also said was efficacy with also reducing symptoms, right? And so all of these things are what we need. We don't want people on ventilators. We want people, if you're going to get it, we want you to have a mild cold-like symptom and live to see the other side of it. We don't want people who go into complete respiratory distress, people that are going to require supplemental oxygen, people that are producing so much phlegm and other things in your lungs where it makes it more difficult to breathe because it is respiratory. And so, and you just talked about the different variants that we're now seeing. And so those variants are definitely a little more contagious than the initial one. So we don't know. So, but yes, those other vaccines, that's going to be another story as it unfolds, and people in the Department of Health and how well they're able to navigate that road for getting enough vaccines for their constituency.
Hey, Jack, I have to tell you though, man, people, to your point, man, this is a different day and time, and folks ask questions. You know, there's the Benz and then there's the Datsun B210. Some people they say, well, if I'm gonna be in a Datsun B210, I might as well be on the vent, because they're thinking that's down there and this is up here, and it just starts that whole.
But we don't want that though, Captain. We don't want that. We need.
I know.
But that's the thing, but it's because people don't know and they're talking about it and they don't know. Johnson & Johnson and AstraZeneca aren't even mRNA-based vaccines. They're adenovirus-based. So their efficacy is not going to be 95 because it's a totally different model.
Right.
Are we
And
even?
So that's why, Dr. K,
yes,
we have to do a education and awareness campaign, right?
Yes.
I mean, because listen, when you turn on the news, pick your channel, and you see that this tally is increasing every day.
Right.
Every day, right? Either directly or indirectly, you may know someone that is going through this coronavirus season, right? I mean, and to Meady's point, I know Meady, so I'm like, oh, whoa, so let's follow her, right? She's a healthcare practitioner, and so if this is happening across the board, all socioeconomics, all ethnicities, urban, suburban, rural, then what we need to do, we as government, federal and state, you all heard me say this before, you need the right leadership in place to have the right strategy. You can't have 159 counties in Georgia and everybody's doing their own thing, because then what's going to happen, let me take care of mine, right? That's what New York was saying. New York's like, you know what, let me buy 10 million more vaccines because I want to take care of New Yorkers. And so you have to have a federal strategy, a state strategy, but you got to have a campaign to educate and build awareness so that way your citizens don't fall victim of the grapevine. That's why we're starting to see a huge disparity in the Black community. Let's call it what it is, right? It's because the Bible says, and I'm no pastor.
Where there's no vision, the people will perish.
Yeah.
And the lack of knowledge.
Yeah.
Right.
Yeah.
And so we got to make sure that we feed them and say, here's Dr. K, here's Meady, both healthcare practitioners. They're in the field. I don't want you to listen to me. I'm the lawmaker. I'm just the one that want to provide money and say, go forth, do great things, help save our citizens, right? That's me. We can't politicize this. That's why I told some of my constituents, and I could be wrong, but the flu vaccine, isn't the efficacy like 40, 50? It's lower, right?
So
the flu shot that we get every year.
Yes, it's only 50 to 60% because it was, so the Johnson & Johnson and AstraZeneca were basically developed similar to how the flu shot is. So the efficacy is going to be lower. And so we have to get people out of that mindset of, oh, it's this. You just need to be vaccinated at this point. And and let's just to put that in context with Black and brown with the brown people, okay? Where did they do their clinical trials? Johnson & Johnson had 42,000 people in their trial, and they did it in South America, Brazil, South Africa, and it only has to be refrigerated. So the reason why a lot of the rural counties are having issues with getting the vaccines distributed to them is because they don't have the freezers. So you have 2 vaccines that have been developed that are effective. It's effective against diseases, and it had a little bit more diverse population. So we can't, these mRNA vaccines were developed from a totally different format. So you can't compare apples to oranges. And that had, as an epidemiologist and an infectious disease epidemiologist, that has been burning me up, because they went that route so that the vaccines could be affordable to those who normally would not have access. These vaccines are like $4 versus $20, $30 for the mRNA vaccines.
And the other thing, Dr. K, is we've been talking about this. And for those of you that are watching, just really be informed. You know, at the end of the day, this is just me. Get something is better than nothing. You know, you have to make sure that you are protecting yourself so you are able to not have symptoms that will get you to the point where you are requiring oxygen and a ventilator. That's really the ultimate goal. And if you have comorbidities, if you have obesity, if you have diabetes, if you have kidney issues, all of those things will be exacerbated no different than it would if you have anything else. If you fell and broke your leg and you have kidney disease, liver failure, whatever, it is going to impact your healing process, even from your orthopedic injury. So at the end of the day, talk to your doctor. And your point, Representative Jackson, is what the issue has been since we talked about this when you and I met and had this conversation back in the summer, was there is now, but there was at that time no consistent messaging and clarity about what it is. And people were saying the wrong terms, people weren't clear, people were not ensuring that, you know, Black and Brown and other disenfranchised, historically disenfranchised groups really understood what it is and how you're able to get access. People were not even clear as why only the healthcare workers. Well, that kind of makes sense, but you have to explain it to everybody else, right? So they understand the why. Because if your whole healthcare force dies off, who's going to care for you? Like you said, you're a politician, you're a Navy man, you're not a nurse. So who's going to take care of you when you need to go to the hospital? So if all of us are dying, and that's a whole nother conversation, because there are a lot of healthcare workers that are starting to get COVID more so now, because people are getting, with the pandemic fatigue, people are not wearing masks like they should, even in the hospital settings. And you will be surprised. I text this to both Dr. K and Jacqueline, that there are still people who don't want to get vaccinated who work in a hospital setting. There are people who are still hesitant, that still have fears. And we are doing our best, you know, to ensure, and I'm not speaking on behalf of where I work, if those of you who know where I work, but I know most hospitals, most medical facilities worth their salt are putting up COVID and vaccine websites for their associates and employees to really get all of the information that Dr. K was just talking about, to, you know, with FAQs, so they can really understand the what, the how, and the why. And they are offering it. And we're even being told, I've been told, and I think it's not, you know, secret, that get the vaccine, because the hospital is not going to just hold on until Meaty decides to get it. And I decide, hey, April, I think I want the vaccine. Well, guess what? We don't have it anymore because we're now doing it for the public, or we're now vaccinating the patients. So the vaccine distribution and administration, even before President Trump, our past president, wanted to have over 200,000 people, 200 million people vaccinated by now. And right now, I just looked on the CDC website, we're only at 33.9 million. So we're over 150 million people that we thought would have been vaccinated by now, and they're not. So at the end of the day, if you can get it, get it. If you want to go to the website, if you want to understand, read it for yourself. Everybody goes to doctors. You have blind trust with them anyway. So you need to have, you need to now reinvigorate that relationship and get that information if you're not clear, and have somebody. Everybody doesn't have access to Dr. K, but I'm sure if you reach out to her on social media, she'll send you a message back and kind of break it down for you. But everybody doesn't have access to an infectious disease epidemiologist to explain it. Neither am I. I'm a cardiac ICU nurse, but I do understand the basics to know why I need to get it.
Mm-hmm. Okay, well, we have another question from our social media, from Facebook. The question is, have the health officials noticed a decrease in the number of hospitalizations since more people are open to getting the vaccine?
Are we seeing a decrease in admissions from COVID since the vaccine?
Right, it says, have health officials noticed a decrease in the number of hospitalizations since more people are open to getting the vaccine?
Well, everybody needs to be clear. No one else, the public is not getting, has not, well, I can only speak to the DMV area. We just started as of like last week, we just started vaccinating those people that are 75 and older. So the short answer is no, not just because of the vaccine. The vaccine was only for healthcare workers, first responders, people, firefighters, et cetera, police officers. Those are the only people who are getting vaccinated. And so we have not seen some drastic decrease in admissions due to the vaccine because the public literally just started getting it about 4 or 5 days ago,
Okay.
at least here in the DC area.
Okay.
So
Okay.
maybe.
And keep in mind too, Jacqueline, that we just went through the heaviest holiday season, right? And so I'm sure Dr. K and Meady can explain that during Thanksgiving and Christmas and New Year's, there were some spikes, right? Because people, for some reason or another, have politicized wearing a mask, right? Dr. Fauci said, your best defense, and this is for our point of view audience, your best defense, even after you get a vaccination shot, is still put on your mask. There's no doubt in my mind that even Meady going through this process, she still wears her mask, right? It's just easier to put on a mask. I got so many masks. Listen, I got a green one with flowers and trees on it. I got a Georgia Bulldog. I got a Georgia Tech. I mean, they give us masks, right?
Look,
this is not
They're even
hard.
telling you to wear 2 masks. They're suggesting that you wear 2 masks.
Where to?
Yeah, people need to understand, even if you're vaccinated, that does not mean that that's your, get out of jail free card and you just get to go and do whatever you want. Everybody needs, until we will be wearing masks, at least at the minimum till the spring, if not further of next year. That's my prediction. So until we only had 33 million people and our country has way more individuals than that. And we're not even talking about the children. Your comment earlier, Jacqueline, I think within today is what? Wednesday. Since Monday, literally since Monday, this is Meady. I've had 8 friends that told me they contracted COVID. 8. And one of them, their son, 2 of them actually had their children. One of their kids is 9.5. The other one has a son who just turned 14. And this is what we're going to start to see, to your point, Representative Jackson and Captain, is that post that holiday season, it's, right after the New Year's time, the kids didn't go back to school till the second week of January. Now you're starting to see some of those respiratory symptoms, et cetera, of where and how people are starting to become symptomatic and get tested. And so one of my friends, her husband was in the basement. Now I said, you need to get tested. Guess what? They're all now, literally her whole house now received it. And then another friend of mine today, same thing. She told me, small little gathering during the holiday season, several of her 4 different households were impacted because of that one small gathering.
Yeah.
Yep. And people are still going out watching sports. We are encouraging folks to stay home for the Super Bowl. Do not go out.
Oh, they already lined up for the Super Bowl.
Oh yeah.
They got their ticket, Cap. They got their ticket, man.
Yeah, that expensive ticket.
It's about, and so we're going to see another spike.
And quite frankly, truthfully, Dr. K, we never not saw the spike, because people think we really had 3 spikes. We had the very initial one, then we had the one sort of after the Labor Day, and the spike that we're seeing now has been consistent since Thanksgiving. So we never completely dipped. So we went and came down a hair, but then it's kind of plateaued, and this spike is still slowly steadying to maintain itself. So yes.
But yeah, another peak rather. We're about to see
those peaks, we are still peaking. And that's the unfortunate part. So at the end of the day, listen, COVID, don't politicize it. It's real. I had it. It wasn't fun. The hardest part, quite frankly, as I shared with Dr. K and Jacqueline, was sitting in a hotel room for 9 days, being quarantined away from my family. The other part of that is understanding if you don't have the funds and access and the ability to actually completely remove yourself from certain environments, because I do have a house. I live in a single family home. It's not large. My basement's not done, right? So where am I going to go and stay away from my husband and son? So I was quarantined. And so we talked about during the last show. So make a plan, because you may get it. And what is that going to look like? And how are you going to be able to maneuver during those uncharted waters? Yeah.
Now, can we
So-
talk a little bit about the test for the COVID-19? Because there's a home test that they're talking about now.
So I'm gonna let Dr. K speak to that. But one thing that I can share is the three things that I'm familiar with and can speak on is your serology test, which is your actual blood test where they check to see if you have antibodies. That's one test. The second one is your PCR, polymerase chain reaction. Here's what I would say to you. If it does not tickle or feel very uncomfortable when you're getting your COVID test, it's probably not getting enough of the viral stuff to, because if you're just going at, and I'm not picking my nose, but if you're just going right here, you're not really getting enough to really make sure you're not going to have a false positive. You need to kind of really get up in your nasal pharyngeal area to really make sure you're getting enough of a culture to make sure that doesn't take place. And then the other part of that is also the rapid tests. You know, these rapid tests, depending upon who's doing it, they're letting the people do their own. You know, you have to be really mindful of that. And I don't know what your thoughts are about that, Dr. K.
Yeah, absolutely. So a lot of these home-based tests have a lot of false negatives because people aren't going to take a sample far enough up their nose. And so again, that's creating another like false sense of security. Like I can do whatever and I'll just test at home. And then if it's negative, I'm going to go out and do whatever. So still the most recognized test is the PCR test. And that's the lab test. The state of Georgia, and I don't know about, and I know other states do, but the state of Georgia separates the positive cases from the antigen test, and those are more so the rapid test because the accuracy is a little lower than the PCR test. So just keep that in mind.
Okay.
And if you
the only thing I want to add to that, and I will have to log off you guys, but I wanted to make sure if you get tested today, because, you know, I'm going to go and visit Representative Jackson and his family, that doesn't mean that I get to then go to his house and just say, oh, I was negative on Monday, but then I don't go and see him until this coming Sunday, unless I'm quarantining between now and Sunday. Because just because Meaty got tested today and then I go and I fly to him, but I've been doing all these other things without wearing my mask, without social distancing, without washing my hands, I very well can be asymptomatic and get to Representative Jackson's house. And then there's another event. So people need to be clear. So when you're getting these tests because you might have to travel or something happens, that's fine. But just please make sure that you are, I mean, fine in the context if you have to go, just make sure that you are still protecting yourself. That doesn't mean you get to go into other activities and other outings before you then go make that necessary travel. So I just want to say thank you all. Thank you for letting me be here, and I'm so excited. And again, I always appreciate the opportunity to share. Please, again, wear your mask at the end of the day. Contact your physician regarding the vaccine. Go online, get the information. It's all there. And to people like you, Jacqueline, and Representative Jackson and Captain, just make sure we are continuing to get that message out, in particular for our Black and Brown individuals as the pandemic goes on, because it's not going away.
Okay. Well, thank you so much for joining us, Meaty. We appreciate it. We're going to continue following your journey. And we'll see you again the next time, okay? Be safe.
Thank you. Be safe. Be well.
You're doing well, too.
Okay.
Thanks, Meaty. So, Dr. K, I'm curious now because down at the Capitol, they have us, they're doing a saliva test.
the saliva
So
test
does-
is actually is the most accurate because it's like it's a bodies, like a sample, like a human sample, so bodily fluid. So it's actually you get more accuracy with saliva testing, but it's
Then,
not readily available.
then if you get more accuracy with the saliva testing, then why aren't they sending that out as the home test as opposed to where you have to actually put the stick in your nose?
Because you have
I'm
to
sorry.
extract RNA from the saliva.
I'm sorry, say that again.
So you have to, there's another step to actually get the RNA from the saliva. So you can't do that at home.
Oh, okay. Okay. I understand. But like Midi was saying, people don't like to be uncomfortable. So when they're putting that stick in their nose, they're not gonna, once it starts to tickle or once it starts to feel uncomfortable, that's
They're
it.
pulling out.
Further. They're not going any
Yeah,
further.
exactly. Yeah. So,
Yes.
and unfortunately, now if you want to travel, there are federal guidelines with traveling.
Yeah.
You're gonna have to be tested at your location where, like, so if you're flying to
Los Angeles.
Jamaica or what? No, was foreign travel. But
Okay.
if you're flying to Jamaica or someplace that whoever will take Americans, because it's not many, and you have to have a negative test that's no less than 3 days old to return back. So you cannot get on a plane unless you have a negative test or you have proof that you've had COVID within the last 90 days. And so a lot of airlines had already started doing like the self-administered antigen test. And guess what? A lot of those aren't approved in other countries.
Mm.
So if that's the case, and if you test positive in another country, you have to quarantine in that country for 10 to 14 days. So you have to make sure that if you are traveling, that you budget an extra 2 weeks just in case.
I mean,
You
that's
end up. So
you end up stuck over somewhere.
Basically.
And look, for some folks, that 2 weeks, that is their vacation.
yep,
Mhm.
absolutely.
Staying
So,
indoors.
so I know there are some mobile labs that does like the saliva testing that I've been working with, but they're not common because of, number one, it's more costly. So, but they're more effective because especially, so another thing that we haven't really talked about is the children returning back to school. So now that they're being socialized back into the community, we're going to see higher numbers in that group. Can y'all imagine trying to test all these kids with these swabs up their nose?
They're not going for that.
Not gonna happen. It's not gonna happen. They're not gonna let you put that in their nose.
So, which is why, just if we could get like some funding or like just really kind of push the saliva testing for schools. And I know that's one thing that I recommended for DeKalb County, because I know back in September when some other states had returned and they were trying to test their kids with the some of the swabs were breaking off because the kids were grabbing the hand of the person testing them, and the sticks broke.
Can you imagine that scene?
So I'm curious now, Dr. K, that you mentioned that because, I'm looking at Jennifer in the industry she's in. She's flying. They're flying across the globe. So I'm just curious when you start talking about the airline industry and these new guidelines and protocols. That could be very costly and I'm just using the airline industry for example, right? Because if you don't have the captain, the co-captain, the flight attendant, and everybody else, that plane ain't leaving, right? They got certain requirements, the amount of sleep that they need. Yeah. We're just talking about normal stuff, Cap. This is just normal stuff. So I'm just curious, how that industry that is traveling across the globe with both domestic and foreign citizens, and that's how this thing can continue to just
just
And
I
snowball.
don't know.
Going.
I don't know how you get this thing under control.
so it's definitely going to have to be coordinated testing with the flight attendants, and I guess Jen can kind of talk about it. What I know what they're doing, and I've been working with some airlines with an airline to try to get some COVID practices in place, because they're like, what do we do now with these new guidelines for traveling? So
Well, I will say that my company does provide testing for us, and they do recommend that we get regular testing. I'm sorry for that feedback, guys. They do recommend that we get regular testing. However, they're not going to look at the vaccine once it does become available. They are recommending it. They are speaking about it and educating us on it. But again, they're not going to necessarily require it for us to work. So,
yeah, and they can't require the vaccine because it's still experimental, and that's what a lot of people have been saying. Well, will they require it for me to go back to work? And I'm like, they realistically, it's not. These aren't approved medicine, and they cannot force you to take something that's experimental. Even though there are some companies that are kind of working around it, saying that it will, as a part of like your contract, you have to do whatever's necessary, to keep people safe or whatever. So that might be a way that they kind of put that into effect. But overall, they can't force you to get vaccinated with an experimental vaccine.
So some of the only things that we're really seeing right now as far as requirements are the mask. Now that is a federal law. Again, like you said, international travel. I just recently did a couple trips up to Canada, and they do require that you do have a negative COVID test, as well as fill out some paperwork letting them know where you'll be staying. So those are some of the things that are currently being enforced, as well as the negative COVID test to come back into the United States. So like you were saying, if someone's trying to travel, they better have that budget in place, because it's not going to be pretty if you've got to stay somewhere for 2 weeks and you only budgeted to be there for 3 or 4 days. So
Right.
just got to read up on whatever location you're going to. They all have different requirements, different guidelines. So just stay informed.
Yes, and they're requiring these negative tests for 2 years and older people. If you're traveling with your kids, they will have to have negative COVID tests too, if they're 2 years or older, 2 years old or older.
Wow. I just, it's just mind blowing, because I'm thinking, and again, when I think of Georgia, Atlanta Hartsfield International Airport, that's one of our largest engines for the state.
Yeah.
I mean, 114 million people go through that airport annually.
Yep.
Average, plus or minus 1 million, right? And so when you think about Georgia, we're like ground zero for a lot of stuff. We got CDC here. We got the world's busiest airport. We're a global juggernaut. Sports, every sport. I'm just trying to wrap my head around how do we get this thing under control.
Yeah.
Especially with the children, and trying to get them
children,
back.
Right. And I saw citizens today, they refuse to put the mask on. I'm like, I want to go jack them up. I'm like, you making my job hard. You do making my job hard. I just want to go punch him in the mouth. And then he's like, what you do that for? I said, because I can see it. Right? I mean, this makes no sense. Right? I prefer for us to be 6 feet apart instead of 6 feet depart.
Right.
There's a difference between apart and depart. Apart is temporary. Depart, that's permanent. 6 feet under. Right? And every day in this legislative session, we have someone going to the well because someone has died.
Mhm.
in one of these 159 counties.
Really, you have to turn it on.
Well,
Yeah.
Time for this evening, Dr.
So wear your mask if you don't want.
Thank you so much. Derek, don't make nobody out there. Thank you so much for joining us. To follow on the continue getting. Guys, remember everything you heard and everything we said was our point of view. We'll see you next time. Bye-bye.
Bye.